Welcome to Nairobi, Kenya.
Thank you.
Dr. Enock, we're here today with Dr. Enock Anasi, who's visiting us from Texas.
Yes.
Dr. Karibu.
Houston, Texas.
Houston, Texas.
Yes.
Karibu, and tell us about yourself.
Thank you so much. I'm originally a Kenyan, of course. I am a pharmacist by profession. I've been a pharmacist for a long time, and after practicing for some years, I decided to go ahead and go to medical school. So I'm also a medical doctor, but right now I'm practicing as a pharmacist who manages formulary in an institution in the United States. Yes.
Tell us about your roles in that formulary team in the hospital.
Yes, in the United States, the practice of pharmacists, actually, we have a special roles which is well defined. We're trying to define ourselves even more. Very soon we'll be actually, we'll be in a position where we can even prescribe medications, but that it will be very specialized, specialized medicine. But right now, I'm a secretary of a committee that governs medications in an institution. It's called Pharmacy and Therapeutics. Pharmacy and Therapeutics is a committee set up by an institution like Kenyatta Hospital that governs any formulary item. There are a lot of medicines in the world, of course. So what this committee does is basically define what role the medication is going to play in an institution, and we meet and discuss. We develop monographs and do research about those medications, and then we say, okay, this medication is going to be added to the formulary for the purpose of being used in this manner. So not only do we admit the medication to the formulary, we also define how that medication is going to be used. Sometimes you may have two medications being used at the same time. I'm an ID specialist, so I may use a lot of examples from the ID area, infectious disease area. So let's say we have a drug called daptomycin, which is used for MRSA, medicinal-resistant Staph aureus. But we do have some other older agents which also can be used for the same. But this medication is very expensive, sometimes it has side effects, but it's a good medication, but an expensive medications. So what we do basically is to say, okay, we're going to add this medication on formulary, but it's going to be used only when these other medications has failed. That's the role that this committee does. I'm the secretary of that committee, and we do have a chair and a secretary. A chair is a medicine person, is a medic, and the secretary is usually a pharmacist. So I'm playing the role of a pharmacist in this area, although I also hold the degree of medicine as well. But in this job, I'm playing the role of a pharmacist.
Okay. Yeah. So what then do you see the role of specialization in this? Because I hear you're talking about therapeutics review,
yes.
And who are the end users? The cadres of professionals who are going to use this review, these protocols that you guys are developing in your facility.
Basically, the end users is actually. First of all, as I said, we have the roles well defined. The physicians prescribe.
Okay.
The pharmacists dispense, but they also not only dispense, but also monitors what those medications, how those medications are going to be used, and whatever comes out of those medication things like side effects. That's the role of a pharmacist. The nurse not dispenses, but administers those medications. So you can see these roles are defined. Over there, the nurse cannot come and dispense medication on my behalf as a pharmacist. Neither can the physician do. The physician's role is to prescribe, I want this medication, I want this daptomycin, for example, to be given to this patient, and the pharmacist gives those medications, and I say, I want you to watch over this kind of side effects when this medication is being used. And the nurse, of course, will go ahead and give those medications. And the pharmacist will be around. After the nurse has given those medications, the pharmacist will be around to monitor what is happening, how that medication is working on that patient. Now, that's why the specialization of a pharmacist comes in. We do have something we call a clinical pharmacist. The clinical pharmacist there is a pharmacist who has had a lot of experience in that area, like myself in infectious disease. Who I've been a clinical pharmacist for a long time, so I'm called a clinical pharmacist. Or someone who has done residency. We do have, after you finish pharmacy, the 6-year pharmacy over there, then you do a residence for 1 year or 2 years specialization. General residence is 1 year, 2 years you specialize in some area. So if you want to go into infectious disease, you finish a pharmacy school, you do residency in general residency, and then you specialize in whatever, oncology, another year. Now, you are in that institution as a clinical pharmacist, and your role is, when the medication has been given to the patient, your role is to monitor what's happening with that patient. The nurse came and gave. The nurse, of course, can see how the medication is doing and all this, but when it comes to as far as how the medication is working or is not working, what the dose should be, how the dose should be given, how it should be adjusted. That's the role of the pharmacist, and that's what the clinical pharmacists do.
Okay, interesting. There's a concept I've heard about admission and discharge pharmacists. Yeah, in admission and discharge pharmacists, what they do is they do reconciliation, medication reconciliation.
Okay. Now,
is that something that we can borrow in Kenya? Because what we find in hospitals, we actually have the nurse just dispenses the medicine, and we don't know what medicine the patient came with. We don't. I don't know what you can tell us.
Actually, that is it. That is the role of the pharmacist. Actually, it's not something which someone should tell you to do. When you are a pharmacist and you are giving this medication to a patient, your role is to talk about this medication. I'm giving you this medication, this is what you're going to expect while you're using the medication and all that. Now, if it's in an institution and the medication is given to a patient, the nurse gives the medication to a patient, the pharmacist is there also monitoring this medication. Now, when the patient is coming in terms of what you're talking about, admission. Admission, when you get admitted to an institution, you need to know what the medication the patient was using. The role of a pharmacist is big in that area. There is actually a pharmacist employed in some institutions, specifically to follow those medications. This patient got admitted yesterday. What medication is this patient using right now? So that when this patient is being admitted and when other medications are being given, you need to know what patient was on and what you're going to put on the patient so that their drug interactions are kind of being monitored at the same time, so you don't duplicate medications. Sometimes, if you just give and the patient was on some medication, sometimes the family can continue, can bring those medications, the patient can continue taking those medications while the patient is with you in the hospital. So, pharmacist has a role in terms of making sure the list of medication the patient came with is written down, it's in the computer somewhere, and then when the new medications are being prescribed, the physician needs to consider these medications.
what are these areas of specializations that you see we need to specialize in?
Okay.
We need to focus in care.
Yeah, there is. Before I answer that question, there is. You asked me a question earlier about the discharge.
Yes.
There is also a role of a pharmacist on discharge medications. You need to be part of the discharge team. I don't know whether you do have. We have discharge team here. There needs to be, if any time the physician is discharging a patient, a pharmacist needs to be part of that. In that way, the pharmacist can actually tell the patient more about the medications. The physician too says something here and there in a very general way, but it's the role of the pharmacist to go in deeper, talking about the drug interactions, talking about what the patient may experience. Yeah. You know, if you hear you take certain medications and you hear, there's muscle aches. Let's say you took a atorvastatin, and you start feeling some muscle pains. That is expected. You just need to let the patient know and be aware of it. But if it becomes too much, then you tell that patient, say, you may want to come back, you may want to call your physician and let him know, so that the physician may be able to...
Or your primary care pharmacist.
Or primary care pharmacist. Or primary care pharmacist. Yeah. So now, if the primary care pharmacist is the one who gave you those medications, of course. Mm-hmm. If it's in an institution, it will be difficult. But if it's in a pharmacy, it was dispensed from a pharmacy. Oh, I've forgotten here. You have to work with a pharmacist. Yes. Okay. Then it makes it easy. Yeah. You need to call the pharmacist. Yeah, exactly. And say, okay, I have pains here and there. What's the problem? The pharmacist can tell you what to do, and you sometimes may actually, there in the United States, pharmacists may sometimes send patient to some areas to actually test what's going on, screen and find out what's going on.
Okay. Thank you. As a parting shot, role of, what do you have to say as you come into the country and look at this profession, and what message of hope do you want to give us?
A message of hope. First of all, I must say, pharmacists, really, there's a lot that a pharmacist needs to do. The physicians have got their role, the nurse have got their role, the pharmacist role has kind of been in between these two. There are certain things. There are certain things that I see practiced here that do not happen in the United States. Sometimes I wonder why. I can see a nurse, kind of prescribing medications sometimes. Really, that should be a role of a medical doctor, and the pharmacist's role really is to dispense. So medical doctor is to prescribe, pharmacist's role is to dispense and advise about the medications, nursing role is to administer. So the nursing role really does not come too much into play when your patient is at home, because the nurse is at an institution.
That's why not the primary care pharmacist.
That's where the primary care pharmacist, because you are closer to that patient than the physician. The physician are kind of a little farther, and the physician may be having a lot of other patients. So since you are the one who gave that medication to the patient, say, hey, call me anytime, and let's talk about this medication, let's review and reconcile. Now you asked me about the clinical pharmacist role. Clinical pharmacist role it needs to expand in this country. Actually, I know of friends, who came from the United States, who have tried really to bring in the clinical part of it in this place. Or Dr. Omega, Dr. Andemo, I know those guys. And here you have a pharmacist, a pharm tech, who is a pharmacist 3 years. pharmaceutic in the United States has completely a different role. It's much lower than it's here. The one we call a pharmaceutic. But since that name is being used for pharmacists who are going to a pharmacy school for 3 years, that is a degree. I presume that's a degree. So those they have a role. They can have pharmacies, dispense, and all that. But when it comes to 5-year pharmacists, those ones should actually be a little bit more specialized in the pharmacy. There must be a difference between the 3-year and 5-year pharmacists. It should not be used interchangeably because you've been in school for 5 years. Therefore, you must know more about medications. You must talk more about medications. Yes, the 3-year can talk about it, but your knowledge and your because of your 5 years and the experience should be a little bit higher. Maybe you should be what we call a clinical pharmacist in the United States. Maybe that's what it should be because you know more about that. Now, what your role should be is a little bit more than just talking about adverse effect. You can talk about adverse effect, but it's more of a clinical part of it. You are being able even to understand the disease conditions a little bit more, not as much as a physician does, but you should be able to understand that hypertension, medication for heart diabetes, or the heart, or you should be able to understand that more, and therefore a clinical pharmacy should be developed in this country, where institutions like Nairobi Hospital, institute like Kenyatta Hospital has what we call a clinical pharmacist. The clinical pharmacist is to advise. Now, what is my role as a clinical pharmacist? For many years, I work with a team. There we have a rounding team. When we round in the morning, there is a physician.
Like a ward round?
A ward round.
Okay.
There is a team. And in that team, there is a pharmacist who is specialized in certain areas. If it's oncology, there is oncology pharmacist. Clinical, we call it clinical pharmacist. The role of that person is to actually, anytime a physician says, I want to administer drug X, let's say in oncology, the pharmacist is even the one who writes those medications down because the pharmacist knows the pharmacokinetic part of it, knows the dosing, the detailed dosing, because some of the patients are dosed based on linear weight, body weight. Some of the patients, drugs are dosed in the whole weight, so to say. So the pharmacist does that. Now, that one has not taken anything away from physicians because the physician does more by giving that role to a pharmacist. And it's a collaboration between the physicians and pharmacists in this case. And the physician should also be comfortable with that pharmacist because the physician has, when a patient comes in, it's that physician's patient. Okay? Now, there are things that play for that physician which pharmacists can do, the nurse can do. But at the end of the day in the United States, if the physician has a big responsibility to that patient. So what physician to trust you and say, dose this patient for me, change the medications, and one time you see that medication is not working, sometimes the pharmacist comes back and say, hey, this medication is not working here. Or the pharmacist, if it's in the area of infectious disease, the patient comes back and the pharmacist comes back and say there is a resistance. There is ESBL, let's say. We may want to change a drug to carbapenem, which covers ESBLs. So that's such kind of role should be the one being tapped by pharmacists. And over there, the pharmacists are doing it right now, and I think it's something we need to start in our country. Let's not leave things just continue the way they are because someone has not complained, because there's so many things which could be better. And And I think in the pharmaceutical world, or the pharmacist world, pharmacists could play a much bigger role than what you are doing right now.
Thank you, Dr. Enock Anasi, for visiting us here and